Which doctor to meet if you have a low back pain? Low back pain is a global burden nowadays, and you all know that it is affecting young people who are as young as 20s and 30s. They are coming to us with back pain, and these back pain numbers are only increasing every year. It's high time that we clear the fuss and myth which surrounds around the back pain. The aim of this talk is to guide these patients to meet a right doctor or a right healthcare provider so that they get permanent cure for their back pain. Some of these patients will become so severe in terms of their pain and disability that they have to go for an MRI and get a surgical opinion, or some people get surgery done. All these things could be avoided if these patients were identified early, diagnosed early, intervened early. Hence, they can prevent the future pain and the disability. Before I get into whom to meet for your back pain, I want to tell something about the back pain. You know, back pain is a symptom. Pain is a symptom. When you pinch here, you get the pain. So, will you treat the pain? No, you have to stop pinching. That means every structure in the back can produce the pain, and this structure at fault must be diagnosed by a healthcare provider so that they will help you treat the pain. But people nowadays, they want quick fix and they expect the pain to go away with that Volini spray, or with their massage, or with their oil application, or even with the anti-inflammatory drug, wherein the body is expressing pain for something which is happening inside. So the pain can come from a nerve, a pain can come from a disc, the pain can come from a joint or a capsule, the pain can come from a muscle, a pain can come probably because of some infection or because of fracture, or even it could be because of some tumor. So there are so many reasons for the back pain. So I expect you to not treat the pain, treat the cause of the back pain. Fortunately, majority of our back pain are mechanical in nature. So I want to make you understand what is mechanical. Mechanical means movement related, mobility related, posture related, which produces mechanical pain. There is something called non-mechanical pain. So when someone gets fracture, someone gets a TB in their spine, someone gets an infection, someone has an autoimmune condition like ankylosing spondylitis or rheumatoid arthritis or psoriatic arthritis. So these are all the conditions which are non-mechanical in nature, rather inflammatory in nature or traumatic in nature, that also can cause back pain. But fortunately, these types of back pain are only 5% to 10% of the overall prevalence of back pain. Majority, I mean to say 90 to 95% of the back pains are mechanical in nature. That means you have created your back pain by your mechanics. Mechanics means movement. Movement means what you do for the entire day is your movement, isn't it? The morning when you wake up, how you brush your teeth, what kind of mattress you sleep, what kind of commode you use, how long you sit in your chair, and what's the density of your sofa, and how you pick up objects, and what kind of physical activities you do in your entire day. Do you walk the dog? Do you sit in front of the computer for too long? Do you do Zumba, or do you do yoga? So these are all the things that you do every day that creates a habit, that creates a pattern of mechanics or movements in your life that decides who will get back pain, who will not get back pain. This is called as a recipe for back pain. This recipe or a pattern must be identified by these healthcare professionals so that they will identify which in your life is producing the back pain. So it's easy to say that your back pain is because of tight muscle, it's because of weak core, and then you get into Pilates or you go to yoga. But I'm saying one thing, the cure is different from relief. Okay, relief is you feel better when you get something done on you, you feel better when you do exercise, you feel better when you get stretching done on you or a massage done on you. Even if you don't do any of these things, you should not have back pain. The cure is permanent, relief is temporary. Even if you take 2 painkillers, you will be having relief of pain, but you all know that how it will work. You will never get that permanent cure with that medicines which you take for back pain, isn't it? Because as I said, majority of the back pain is lifestyle related, your posture related, your movement related, your mechanics related. Put together we call it as a mechanical pain. So when the pain is mechanical in nature, you have to have a mechanical solution. Such mechanical back pains should be treated mechanically, not pharmacologically. And that solution will be offered by someone who understands the biomechanics of the spine, someone who understands the movement related signs, someone who understands your postural pattern, who can analyze your life habits, all put together. Then we'll be able to analyze your pain pattern. We ask these questions: do you stuck like this when you wake up in the morning? Okay, when you come out of the car, you have difficulty in initiating first few steps. When you sit on the commode and get up, do you have pain? When you cough and sneeze, you have pain. Do you have the pain radiating down to the leg and causing some tingling numbness in the foot? Do you feel some awkward sensation in the thigh as a result of the back pain? Do you feel pain after doing that yoga stretches? So these are some of the pertinent questions that will be asked to know the nature of your mechanical pain. With that, a diagnosis should be made. Not just putting the oil and rubbing over the body and thinking that you are detoxifying yourself and then you will be getting rid of the pain. Never it will happen in your life. There is no such treatment which can permanently cure your back pain. Some of my patients, they get up in the morning and then they feel very stiff and they become like this. They think this stiffness is because of gastric stiffness, and they think they have to take antacids, and they stop eating potatoes and other food items which produces the gas. It's a false assumption. It's not because of a gastric that you have a back pain. If you have pain in the back, treat the back. If you have pain in the back, don't go to the stomach first. Go to the back first. See what's there in the back and evaluate it. Back has bones, and the back has bones and muscles and joints and nerves and disc. It can produce the pain, isn't it? Stomach and intestine can cause back pain, but it's very rare compared to what is currently causing back pain, which is your mechanical back pain. If you think back pain itself is a diagnosis, then anything becomes a treatment. You can go to anybody in the healthcare provider, they will say they will treat your back pain. When you consider back pain as a symptom, then you will be very keen on diagnosing what is causing the back pain, and that is going to help you in getting the recovery. Okay. In our understanding, most of the mechanical back pains are acquired by your lifestyle habits, by your movement patterns, by your physical demands, by your posture. Let me tell the broad classification of the back pain. The back pain can be mechanical in nature or non-mechanical in nature. The non-mechanical back pains are infective back pains, inflammatory back pains, or autoimmune back pains, or your traumatic back pains. So if it is a traumatic back pain, say if you fell down somewhere and then you think it's swollen so much and then severe pain, unable to get up, then you have to meet an orthopedician who are specialized in treating the spine. They probably have to get the MRI done and see whether you have a fracture or something. When you have an inflammatory or autoimmune back pain, how do you know that? You will have pain all over the body. Probably if you have done a blood test, then your CRP and ESR will be elevated, and then if you have accompanying back pain, then you have to meet a rheumatologist. What is infective related back pain? Let's say you had recent viral fever, or you have a dengue or something, or chikungunya. These are the conditions where the infection will also happen in the spine, for which you have to get the opinion from the general medicine doctor who have done their MD general medicine. They will be giving you medicines for infection and so on. Okay, when the back pain is severe in nature, that it is going all the way down to the leg, and then you have difficulty in urination or food drop, or unable to walk because of tremendous weakness, then you have to go consult a neurologist or a neurosurgeon, because they are the one who are specialists in treating the nerve related conditions. So in such case you have to meet the neurologist. Okay, they will be probably getting the MRI done to see how much of your nerve is compressed, and maybe do you need a surgery or so. So that's their decision. So these are all the non-mechanical category. But as I said, this composites only 5 to 10% of the overall back pains. Remaining 90% back pains are movement related back pains, can be treated by a physiotherapist who understands the biomechanics, who understands the pathomechanics of the spine, who understands the movement pattern disorders. So they'll be able to analyze your movement pattern, your pain locality, your extent of pain radiation, does it have nerve compromise, or only the pain in the central back pain. So based on so many questions that they ask you, based on analyzing your movements, based on analyzing your lifestyle, they will be able to tell this is what is causing you the back pain, this is what you have to do as an intervention. So you will be able to come out of the back pain pretty easily without complicating yourself from going to the chronic back pain status. So even with the physiotherapist, he should be able to teach you the exercise based treatment which is guided by your physical therapist. So for mechanical back pain, okay, he will be telling you how to sit, how to get up, how to pick up an object, and how much to walk, and what kind of strengthening exercise you have to do and what not to do, and finally he will be able to diagnose whether your disc is at fault, your nerves are compressed, or there is a facet joint problem, is the muscles are weak, or is it tight, or is there any movement patterning disorder. With all these things, a perfect recipe of treatment will be given, which is salient to your pathological manifestation will be given to you, and that is going to cure your back pain. So to summarize, if it is a mechanical back pain, meet a physical therapist who is sound in understanding the biomechanics and pathomechanics of the spine. If the pain is non-mechanical in nature, meet the doctors like orthopedicians or rheumatologists who are good in managing your problem. But as I said, majority are mechanical, so meet a good physical therapist so that your chances of getting a permanent cure is a real possibility. I hope this video helped you a bit. Keep watching. Thank you so much.